Hello and welcome to today's webinar, which will be focusing on conservation, access, and human well-being. Before we get started with today's session, I want to share a few quick announcements. First, many thanks to those of you who submitted questions for today's program when you registered. You can also ask a question as the program is taking place in real time. There's a Q&A feature on the dashboard, and you can enter your questions there. We'll be monitoring those questions throughout the program. And please use the Q&A tab to submit questions for the presenters and communicate with us if you have any technical issues. This program is being recorded, so once it ends, everyone who registered will receive an email with a link to the recording, and that'll happen in about 2 weeks. My name is Dr. Dennis Stoley, and I'm the head of applied psychology at the American Psychological Association. The American Psychological Association is delighted to be collaborating on this webinar with the World Wildlife Fund and the Society for Environmental, Population, and Conservation Psychology, which is Division 34 of the APA. APA is dedicated to applying psychological science to contribute to the challenge of sustainability and to understanding and promoting responsible human decision-making and behavior regarding our climate and our environment. This is the second in a series of 3 webinars dedicated to forests and psychological science. Further, beyond this webinar series, we look forward to fostering continuing collaborations with the World Wildlife Fund and the Society for Environmental, Population, and Conservation Psychology. I'm delighted that we're joined today by Amy Smith, WWF's Director of Sustainable Natural Rubber and Forest. Welcome, Amy.
Thank you for the warm welcome, Dennis. It's great to be a part of our second webinar with APA. For those of you who haven't heard about WWF, we're a leading global conservation organization. We're operating in about 100 countries with around 8,000 staff and 5 million supporters globally. Our work includes conserving ecosystems, protecting critically endangered wildlife, and confronting climate change. It also includes efforts that we're undertaking at the intersection of forests and human health. And this is why we are delighted to have this opportunity to share more with this audience about that part of our conservation work. Forests are indispensable to human health. They provide food, fuel, and fiber that support people's physical and economic well-being. They also purify our air and water, capture carbon, which helps mitigate the detrimental impacts of climate change. And the relationship between healthy people and forests is even more complex. Forests can reduce disease risk, including cardiovascular and respiratory diseases, cancers, and can improve mental health. In fact, preventing forest loss and degradation is our most cost-effective means of delivering more equitable health outcomes, including preventing infectious disease outbreaks such as COVID-19. Forests also protect against physical hazards such as flooding and extreme weather and other health issues that threaten human lives. Unfortunately, philanthropic and public funding, healthcare systems, insurance models, and land use planning priorities typically don't reflect the importance of forests to human health. Through our Forest and Health Initiative, WWF is working to change that by raising awareness about the important link between forest health and human health and fostering collaboration across a wider array of partners. This is why we're collaborating with APA. By breaking down silos and forging partnerships with organizations that have very different expertise from ours, we have much greater likelihood of devising more effective solutions that ultimately will lead to better forest and human health outcomes. This is really because problems will be approached through a broader, more comprehensive lens that wouldn't be possible if we were to go it alone. Our aim is to prioritize forests and their conservation as a meaningful public health solution. And we're excited to have another opportunity today to dive into that topic. And we're looking forward to hearing the insights of our WWF and APA panelists. So with that, I will hand it back over to you, Dennis. Thank you.
Thanks so much, Amy. And without further ado, I am delighted to be able to introduce our group of expert panelists that will be presenting and discussing these topics with us today. And I'll start with Craig Beatty. Craig is the manager of forest strategy and research at WWF US. In that position, he provides technical and scientific leadership to the organization's major forest initiatives. His work includes helping lead the development of a corporate framework for setting science-based targets for nature. He also works on creating methods and tools to estimate conservation and restoration impact. And he focuses on exploring and understanding the role that forests play in human health. Next, we have Dr. Neil Lewis Jr. Neil is a behavioral and intervention scientist at Cornell University and Weill Cornell Medicine, where he's an associate professor in the Department of Communication, Division of General Internal Medicine, and graduate field of psychology. His research examines the motivational, behavioral, and equity implications of social interventions and policies and their effects on individuals, organizations, and communities. Much of Neil's work focuses on understanding and addressing inequality in education, health, and environmental outcomes. Finally, we have Dr. Patricia Winter. Pat is an emeritus scientist with the USDA Forest Service Pacific Southwest Research Station. Her current research focuses on outdoor recreation's vulnerability to climate change. This focus has been applied most recently to the Southern California National Forest and Santa Monica Mountains National Recreation Area. Through applications of psychology and related social sciences, she illuminates current and projected climate change impacts on the experiences and benefits to outdoor recreation and management. And so to begin our presentations, what I'd like to do, if you're ready to go, Craig, is go ahead and turn the floor over to you.
Excellent. Thanks, Dennis and Amy, and a warm welcome to everyone, even though I cannot see you. Thanks for the invitation today. And I want to start off today with a question. And I'd like for the folks that are participating today to respond in the chat, which I've just learned will kind of go into the ether for you, but we'll be able to see everything. And don't worry, we'll come back to it at the end of our time here. So if you can click on to the next slide. All right, so how do you think, the slide before that, sorry. Yeah. How do you think forests are harmful or helpful for human health? And as you go ahead and populate the chat with your answers, I'm going to go ahead as well. So a few weeks ago, I was at a conference hosted by the Global Land Program with a bunch of land system scientists. And when I said I worked for WWF, they said, wait, WWF, don't you guys just save adorable animals? So if you're surprised to see WWF in a forum like this, you're not alone. And yes, we definitely do help save adorable animals as well, many of whom live in forests. But in support of nature as a whole, we also work to address the reasons why life on Earth is shifting under our feet. So the drivers of that imbalance between humanity and non-human nature. So at WWF, like Dennis mentioned, I work on the forest team where I manage research and strategy. And a couple of years ago, we released a report called The Vitality of Forests, which investigated the evidence for the contributions that forests make to human health. And I love to talk about how important forests are for people and for nature, and have done a lot of work with a lot of communities and governments around the world in support of the role that forests can play in human lives. And I suppose there's a reason that they say that when you're a hammer, every problem looks like a nail. And that's really no different when you're a person working on forests. They just tend to look like a solution to everything. And don't get me wrong, they can sure solve a lot of problems, and we're going to see that. But are they a solution to human health problems too? And we had an opportunity to explore this question. And I want to read to you a quote that really zapped me like a lightning bolt when we were investigating forests and human health for the Vitality of Forests report. Next slide. So I'm not going to spend a lot of time talking about the pandemic, We all spent a lot of time there, and there's not a lot of fondness around it for a lot of good reasons. But I do want to point out that we started to work on forest and human health in a pre-pandemic 2019. And then at every turn over the next 3 years, new evidence supported the connections between conservation and human health. None more clearly than the last two paragraphs of this long technical paper by David Morenz and Anthony Fauci from September of 2020 on how we got to COVID. And I'm going to pause and I'm going to read it in silence, and I welcome you guys to read it as well as I do. So it should force us to begin to think in earnest and collectively about living in more thoughtful and creative harmony with nature. Thoughtful and creative harmony with nature. This is WWF's mission, to build a future where people and nature live in harmony. And there it sits as the capstone of a paper that described the complicated emergence of a novel virus through which each of our lives were upended, and more than 9 million of our friends, colleagues, and family members lost their lives. So for me, this really confirmed that conservation's role could not be closer to human well-being. And what we found in our review of forests and human health was that this certainly wasn't confined only to infectious diseases. Next. So in fact, when we looked across 5 main dimensions of human health, non-communicable diseases, environmental exposure to pollution, food and nutrition, physical hazards, including heat and infectious diseases, we found evidence in each of those realms of the connection between forests and human health. And we organized it into the framework that you see here that unites these dimensions and places them in a geographic and social context that aligns with the presence or the absence of forests. I'm especially proud that we made it through editing with a dark side of the moon rainbow built into this figure. And I think mostly it stayed because it meaningfully speaks to the magnitude of forest contributions in each dimension to human health across the spectrum of intact and functional forests on the left to deforested landscapes in urban areas on the right. But how forests and human health interact at a societal scale also depends on groups of people in many interacting ways. These impacts are different depending on whether people are forest dependent, whether they live and work in rural areas, or whether they live in cities. And apart from their geography, the relationship between people and forests is also affected by environmental, institutional, or behavioral factors that influence the ability of forests to support human health, what we call here contextual factors. And finally, when we thought about human health and a person's relationship to forests on an individual level, we saw all sorts of mediating factors that limit that person's ability to realize or accrue the health benefits of forests. These include social needs and demands, access to forests and their accessibility based on all sorts of other barriers, the proximity and affordability of forests, and pre-existing health conditions. So how forests provide, prevent, and heal for each person will differ. And the role that forests play to an individual, all the way to the role that they play at larger scales of human health, can be different. But there are some common conclusions that we can draw from the literature regarding the contributions that forests make to human health. Next. So what our Vitality of Forests report demonstrated is that the evidence for the positive impact that forests can have on human health is overwhelming, but still incomplete across all 5 of these categories. In each of these interactions, there's a need for additional research. But what we can say so far is that forests provide both physiological and psychological benefits related with risk reduction for some non-communicable diseases. Forests filter pollutants from the air and water and reduce disease risk. Forests can provide nutritional quality, especially for local children and mothers at critical developmental stages. Well-managed forests can mitigate floods and permit natural fire cycles while also reducing ambient air temperatures, and forests can prevent the emergence and the spread of infectious disease. And then if we think of human health at a planetary scale, the importance of forests is undeniable. There is no solution to climate change that does not include forests in some capacity. There is also no solution to the loss of biodiversity and its critical contributions to our lives and everyone's lives that does not in some way include forests. And if this wasn't enough, we now contend that working to address human health challenges without the support and creativity provided by forests is also not possible. But this leads me to one of the main questions that I'd like to explore today, and it gets to the thoughtful and creative part of what we need to do to fix our broken relationship with nature, which I've been calling the West Virginia paradox. Next slide. So here's the paradox. If forests overwhelmingly contribute to human health, then why is human health poor in many places with more forest? And this doesn't just apply to West Virginia. West Virginia has really good data on forest cover and really good data on human health metrics that make it easy to look at this paradox. I happen to live in Maryland, which is right next door to West Virginia, but this is not just a West Virginia paradox. At WWF, we're used to advocating and will continue to advocate for forest restoration, quality forest management, and forest conservation. And when we look at the science on climate change and biodiversity loss, it's clear that both of those crises require more forest globally. And there is a lot of nuance in that statement in terms of where and when and how. But to address those big crises, the world will need more quality forests that support nature and people. But there might be some additional complexity in forest and health that requires insights and participation from experts in public health that we just don't have in conservation. And Amy mentioned that in her introduction. But what about the other states? So if I say West Virginia is the third most forested state but tops the list, what are the other ones? And that's a common question. So in fact, when you look at the list, if you go to the next slide, you can look at the list of the most forested states and the list of the most unhealthy states. So at the top of the list, 4 of the top forested are also the most unhealthy. You'll see New England has a lot of forest, but it's not especially unhealthy. The southeastern US and Appalachia have a lot of forest and are the most unhealthy. So then I apologize because I looked at this late last night, so I didn't include it in the slides. But which are the poorest states? But okay, easy fix. It's actually the same exact list as the most unhealthy states, except that the order is a bit rearranged and Mississippi's at the top and they're in a different order, but all of the most unhealthy states are also the poor states. So the poor states are the ones that are unhealthiest for people. So lack of funding for public health leads to unhealthy people, and maybe this isn't surprising. But given the overwhelming evidence for the positive impact that forests have on human health, in particular for non-communicable diseases, pollution reduction, and food and nutrition, sources for many of the risk factors for the diseases and afflictions that make these states the most unhealthy, why are people in these heavily forested states still so unhealthy? Next slide. So the quick answer is that more forest does not automatically translate to better human health. In a lot of contexts, it does. And there's a lot of evidence from our work in forest restoration in particular that restoration and conservation do translate to better human health, but not always, and not in West Virginia. I especially wanted to talk about this paradox with this group because I feel like there might be some overlaps and partnerships in understanding how to deploy or amend conservation actions in support of human health. In the West Virginia context, given that the benefits of forests generally exist already in West Virginia, what then are the barriers to translating that to human health gains? So if we understand the factors that are mediating human health as it relates to forests, things like social demands and standards, access, proximity, affordability, then especially in psychology, do we have an opportunity to explore social demands and structures around how people interact with and perceive forests? And can we address part of the behavioral or the institutional systems that we steer at APA, WWF, in academia, and in government in support of both how public health can support conservation, but also how conservation can support public health? Next slide. So really what I've done is I've moved from how do we explain the West Virginia paradox to I think what is a more interesting question. What do we do with the West Virginia paradox? And the easy answer is to say, well, of course, there's a lot more to human health than just forests for each of these categories of human health. Income and poverty are clearly in the driver's seat, so let's just focus on that. But my doctor likes to remind me that I cannot outrun a bad diet as much as I try. And addressing income and poverty without addressing the aggressive, damaging, and unbalanced interactions with nature that erode the foundations of human health is probably not a great long-term approach. So given everything that I've outlined about the outsized role that forests play in addressing climate change and biodiversity loss, and the fact that forests support improvements to human health, there's likely an opportunity to look at some of the issues surrounding human health, not with an income and poverty lens only, but also through an environment, land tenure, human rights, and forest-colored glasses approach. In reality, there may be no better place to do this than in places like West Virginia or in other states or places that top the list of unhealthy places. Next slide. So now we can go back to your responses in the chat and start to think about the perspectives that we put into those answers. Ecologically, socially, economically, psychology, forests are overwhelmingly helpful for human health. The evidence clearly demonstrates this. But high forest cover in American states somewhat correlates with unhealthy people. As WWF, we have to look at how forest conservation, restoration, and improved management can support people in many places around the world. And it is true, in lots of places, more forests can lead to better health outcomes. But we also need to explore how forest quality can impact the ability of a forest to support human health. We can explore the different scales at which forests and human health operate, from social and institutional to community and individual. And we can collaborate on weakening the barriers that keep people from realizing the benefits of forests for their health. So finally, given the interaction between forests, human health, and the contextual and mediating factors, how can WWF, as a conservation organization, advocate for an approach to human health through forests that is more nuanced than more forests equates with better human health? The West Virginia paradox demonstrates a lot of interesting nuance. So what can we learn, and with whom can we partner to make sure that the work that we do in support of human health through forest conservation, management, and restoration will deliver the outcomes that align with living in more thoughtful and creative harmony with nature? Again, my name is Craig Beatty, and on behalf of World Wildlife Fund, thanks so much for coming today. Dennis.
Thank you so much for that wonderful presentation, Craig. The West Virginia paradox is fascinating, and I think it just does a great job of illustrating the danger in oversimplifying some of these issues. And so I'm really looking forward to diving into those issues with you more in the discussion portion of our time today. Now, though, I'd like to turn to Dr. Neil Lewis Jr. For his presentation. And Neil, you can take it away whenever you're ready.
Thank you, Dennis. And good afternoon, everyone. I want to quickly start off by thanking the organizers for inviting me to be part of this panel and discussion. And thank you for joining us for this conversation. So with my time, I'm not going to focus on forests per se, but on how humans think about and engage with a variety of environmental issues more broadly. And really how that varies depending on which humans we're talking about and where they're situated. And I think some of that will connect nicely to what Craig was just talking about. So to get started, I want to share a bit of background about my work, because I think that'll help you understand how and why it is I think about these issues, what are really issues of environmental justice and environmental injustice in the ways that I do, as well as why we study that topic in the ways that we do. So I was trained as a social psychologist originally and began my career studying inequality in education, actually. And that issue is what I was initially interested in. It's what led me to go to graduate school and pursue a psychology degree. I really wanted to understand that in order to be able to come up with interventions and potential solutions that could improve equity in educational outcomes. The thing is, if you study education long enough and you study inequality in education long enough, you will eventually run into research on health inequality, right? One of the reasons that we see so many inequities in educational outcomes is due to inequities in health that undermine students' abilities to learn, right? It's harder to learn when you're in a situation that's making you sick than if you're in a healthier environment. So health then became the second big domain of my research. I really needed to understand health issues in order to improve educational outcomes. You might see where this is going. If you go down the health rabbit hole long enough, you're eventually going to run into environmental injustices, right? So you'll start to learn more about the unequal social forces that exist in our society that lead some groups of people to have greater exposure to environmental hazards than others, or to lack having access to the environmental benefits of green spaces and the like that affect people's opportunities to live healthy lives. All of these things are really interconnected. And I mentioned that because it matters for how we do research on and talk about environmental issues and the effects that they have on human well-being. I work in academia, and in academia, we often like to separate these issues into their own silos. So education researchers are located in one part of the university, in an ed school, for instance, where they talk to other education people. The health researchers are often in another part of the university, say in a public health school, where they talk with other health people. And the environmental folks are in a third part of the university, in a school of natural resources and the environment, for instance, where they're mostly talking to other environmental scholars. And so that's the way we often think about these in our sort of formal academic structures. But that's not how everyday people who live out their lives in a variety of communities experience these things, right? So the people who are facing a lot of environmental crises, environmental hazards, are often the people who are also dealing with health issues and education issues and other issues that you as a researcher in your silo might not have initially thought about. And I think some of that's what you were seeing in the West Virginia paradox that we were just talking about, right? Some of these things, variables get clustered in really interesting ways. But that's something that's come up many times in our work and is something that we more broadly as a community need to think about. And I'll share a few examples of how these things manifest. So a few years ago, we did some studies where we were trying to understand people's concerns about environmental issues. So in one of these studies, we worked with some Latino surveying community organizations in Texas. And we asked people there, what are the big environmental issues they're concerned about? Um, and their answers were really interesting to look at when we were analyzing the data. Some of the things participants said were expected. So they talked about air pollution issues. They talked about lack of access to green space, for instance. So that was somewhat expected. But they also said things like, racism and poverty. Those are important environmental issues that they're concerned about. And when they said that, they explained in great detail how things like segregation in their cities and the different allocation of resources to different neighborhoods meant that their kids didn't have access to the same opportunities to breathe clean air, play outside in green spaces, and so forth, as kids in the wealthier white neighborhoods. And so this is one of these ways in which these broader social experiences of racial and class segregation, which ends up being top of mind for people, right? Those counted as very serious environmental issues, even though that's not what environmental scholars might necessarily often think about. So we got those initial findings, and there was this question that came up of, well, was there something unique about the particular communities that we're working with, that we're studying, or is this a more general phenomenon in the broader US population? So we ran another study to find out the answers to that. So in that follow-up study, we recruited over 1,000 Americans who were living all over the United States as part of this broader national study to find out what are people's environmental concerns and how are they thinking about them. When we did that second larger study, we found that the patterns we previously found in Texas were not unique to that location or to those particular communities. In fact, it turns out that some of the biggest predictors of how Americans are thinking about environmental issues are their race, ethnicity, and their socioeconomic status. All right, so the ways that people are experiencing these issues in different places in the country are really shaping the psychology behind how they think about these issues. And my point in sharing that is just to remind us that these broader social environments that we're living in and the ways that they affect our day-to-day experiences, those things matter a lot for how people think about these issues. And that's something that I think is important for all of us to keep in mind as we study these issues, as we talk about them in panels like this, and as we work in collaboration to try and address these issues. So thank you, and I look forward to further discussion.
Thank you so much, Neil. And what I'd like to do at this point is turn to our third panelist, Dr. Patricia Winter. And Pat, whenever you're ready, you can take it over.
Just waiting on my slides. Perfect. Thank you so much. I'm grateful to today's webinar organizers as well as the audience here. I hope you hear some things that are of interest and perhaps unique to today's presentations. I want to just note that my presentation captures some recent work I've been doing over about the past 8 years surrounding climate change vulnerability assessments for outdoor recreation. And this work helps inform management decisions and aids adaptation measures for forest management. It also helps meet a requirement for forest planning and forest plan revision. Next slide, please. Now, there's already been excellent coverage of some of the benefits of nature exposure and outdoor recreation in terms of just nature and forests from our previous speakers, as well as excellent coverage from Michelle Kondo in our first webinar. Many factors influence benefits derived, including dose exposure, as noted by Michelle Kondo in the prior webinar, and the type of activity engaged in. But benefits are enjoyed at the individual all the way up to the community and societal scale. So outdoor recreation has a very important role in well-being overall, helping to influence such outcomes as affect, including awe, cognitive benefits, socio-emotional well-being, and physical improvements. I've been spending some of my research time prior to these vulnerability assessments looking at connection with nature among youth, just as one example, because of its myriad benefits that extend out from that connection in terms of environmental concern and real environmental responsibility and responsible behaviors. Next slide, please. These benefits have elevated importance for members of marginalized groups. Neil introduced a couple of issues that I think I can reflect back on, which is lower socioeconomic groups experience a greater benefit from green spaces that are nearby their communities where they live, in part because individuals from these communities are less able to seek respite from their immediate environments. For example, these communities tend to be characterized by lower tree canopy cover, which is of a fair amount of concern in terms of community well-being. And lower socioeconomic groups are also more impacted by urban blight. Outdoor recreation and nature exposure more generally can help to alleviate some of the income-related inequalities in health. Equity is paramount to contributions towards current and future sustainability. So we've been focusing quite a bit on equitable access to outdoor recreation. Next slide, please. Here's a study that was conducted a while back looking at ethno-racial diversity across the United States and representation among national forest visits. as captured by the National Visitor Use Monitoring Survey. The 2010 census showed that about 63% of the US population self-identified as white or Caucasian, whereas about 95% of national forest visitation was represented by white recreationists. In contrast, Blacks or African Americans made up about 13% of the population and only accounted for about 1% of national forest visitation, and Hispanics at 17% of the US population at that particular time, and just under 6% of national forest visitation. So there's a real equity gap between overall population and representation among national forest visitors. Next slide, please. If we take that to the state of California, which is markedly diverse, I conducted a study with colleagues looking at whether or not an individual had ever visited a national forest within their lifetime. This was conducted among randomly selected residents in large metro areas across the state. And we found that about 95% or more of the white respondents had visited a national forest within their lifetime, whereas only about half of Latinas had done so anytime during their lives, and just a little over half for our Black or African American respondents. Next slide, please. Among those participating in outdoor recreation, there are some patterns of interest that link to climate change effects I'll discuss in just a minute. Members of Latino groups and some Asian groups tend towards recreating in larger extended family groups. Latinos and Blacks tend to prefer guided experiences, as well as locations with a greater number of amenities, so semi-developed day use areas or overnight sites with a degree of development. And among Latino visitors in particular in California, areas visited by similar ethno-racial groups. So you'll see a vast majority of visitors at some of these locations being Hispanic or Latino. Visitors who come to the forest less frequently tend to cite time as a main barrier, and this is common among all ethno-racial groups. But what's unique to these less frequent visitors who are from communities of color are the mentions of the lack of resources, including money or access to transportation to get to forest locations, as well as a lack of information about where opportunities exist and what they might do there. Next slide, please. Climate change is having effects already on recreation and is having impacts on the recreation experience. We're seeing overall, although there is variability across the US based on elevation and geographic location, an increase in overall ambient temperature and an extended warm weather season, as well as an increase in the number of high heat days. Now, this is actually in some ways viewed as good news because it increases the demand for outdoor recreation over the period of time. However, this can also lead to issues related to overcrowding and the need to manage level of visitation. And it also can present risks to the individual recreationists because of too high heat and experiences related to heat effects. Changes in precipitation are a little more variable in terms of climate projections, but we have in California experienced periods of extended drought, as well as intermittent atmospheric river events. And both of these have accounted for shifts in water flow, where some water-based recreation opportunities have decreased, for example, less access for fishing or water play. And then the atmospheric river events have led to dramatic changes to built and natural infrastructure, which has affected in particular those types of amenities that I mentioned before that are preferred by some members of Hispanic and African American communities. Wildfires, in addition, are becoming more frequent and of higher severity. And these, as well as the changes in precipitation, have led to some safety-related closures, both short and long-term, over small areas as well as at larger landscape scales. And some of these long-term closures are for the ecosystem or for infrastructure to be repaired and recovered and to improve visitor safety. Next slide, please. Now, recreationists typically respond on the National Visitor Use Monitoring Survey that if a site were not available, they would go elsewhere for the same or a different activity, or in some cases might stay home. Now, this assumes there's a capacity to shift timing and location where recreation takes place, and the capacity to travel elsewhere, as well as to use information sources to plan and adapt those plans as needed. Here we have little information on the impact of the benefits derived, in particular, the benefits to outdoor recreation groups more generally, but also to underrepresented groups who are rarely seen already among outdoor recreationists and may in fact not be able to exercise these degrees of flexibility assumed for recreation adaptation. Next slide, please. Managers can take a number of different measures, including shifting staffing and resources to try and accommodate for shifts in demand or areas being open or needing to be closed. Managing agencies need to exercise limits to overall visitation if demand increases too much and it exceeds capacity by implementing a reservation system, issuing permits that folks have to apply for, or asking folks to pay fees. Planning is now recommended at the landscape scale or larger so that managing agencies are able to consider if an activity isn't available in one area, whether or not we might be able to refer visitors to another area. But all of this suggests a degree of flexibility that may or may not characterize the impacts on underrepresented groups and how they may adjust. So key is partnering with those groups to increase cultural competence overall in terms of the understanding of impacts, the experience of outdoor recreation and the types of activities desired, as well as to ensure improved procedural justice. Next slide, please. So to close up here, some of the touchstone concepts behind improving approaches involves three keywords introduced by a colleague, Deb Chavez, which is invite, involve, and include. So to invite, we practice meeting people where they live, work, play, and connect. Part of this is demonstrated through our urban field stations in Los Angeles, Baltimore, and New York, and elsewhere, where we meet people in downtown Los Angeles and talk with them about forest recreation opportunities, not only what they might do when they arrive on the forest, but how they might get there, and then supporting resources that may be available to them to be able to enjoy the experiences that are being offered. There's a degree of involvement that is needed to change the narrative around outdoor recreation, to broaden our concepts about what the experience may involve and how people may connect and interact with the land. And then finally, practicing inclusion or including folks involves building a sense of belonging or community that's shared among communities of color. And this has been a particularly powerful evolution across the last couple of decades demonstrated by the work of many organizations, including Latino Outdoors and Outdoor Afro, who've both focused very heavily on engaging underrepresented groups and ensuring that the message of belongingness is clear and is reinforced. And with that, I thank you.
Thank you so much for that presentation, Pat. At this point, what I'd like to do is turn to the discussion portion of our panel today. And I'd like to begin with a question that was submitted to us from the audience. And what I'd really like to do is address this question initially to you, Craig, but with recognition that Neil and Pat, you may have thoughts about this question as well. And so I invite you to chime in as well. And the gist of the question, which I think really may cross-pollinate a lot of the issues that we've been talking about, including the West Virginia paradox, is we've been talking about forests and human health with somewhat of an emphasis on the human health as opposed to the health of the forest. And surely not all forests are created equal. And so does that matter? And how do we think about the health or the quality of a forest? Are there ways that WWF thinks about that or measures by which this can be assessed? And is that important to be thinking about in terms of the interaction of a human being with a forest, and whether it's a high quality forest, a low quality forest, if there's even such a thing as a high or low quality?
Yeah, this is a really great question. And when we were working on our Vitality of Forest report, we started thinking about, okay, healthy forests, healthy people. And I think there's an initiative out there that's working on that as well. Healthy forests and healthy people. And as we started getting into the research on the connections between forests and human health, we hit a barrier because there was almost no research that looked at the quality of forest as it related to human health, just the presence or the absence of forest. And the only places that we were able to look kind of at quality in terms of nature were in studies that looked at the presence of green space and maybe the quality of green space. But most of those didn't differentiate between a soccer field and a forest, and so were less useful for us in being able to demonstrate the evidence behind the connections between forest and human health. From our perspective, absolutely the quality of the forest matters. And for all of those different components, people know when if you're looking at the components of human health across the five, and you're thinking about forest bathing, right? Which someone had asked in the chat, are we going to talk about forest bathing? If forest bathing is something that you're interested in doing, the quality of the forest very much matters in terms of how safe and how much you take in from that forest. And it's the same for nutrition. If you have a very degraded forest, you're not going to get the food and nutrition from a place that's as degraded as maybe a quality forest. So absolutely, the quality of the forest matters. And that is a huge gap in research in terms of health and forest quality. And I would shoot that out to everyone on this webinar. If we can get more research understanding how the quality of forests impacts human health, would be in a much better place to respond in conservation and public health to the quality of those habitats and how they relate to people.
Thanks, Craig. And Pat and Neil, if you have anything to add to that, feel free to jump in. Pat, I see you've come off mute.
Yes, so what this brings to mind for me is a focus embedded in our vulnerability assessments, which is looking at what's happening ecologically and how that affects the outdoor recreation experience and the benefits that are derived. So we're looking at issues such as extended heat and low precipitation affecting the ability to maintain a healthy tree canopy cover, intersecting with wildfires that may wipe out sections of a forest, and the difficulties in restoration. And that's actually a piece of our latest vulnerability assessment that's in press at the moment. And we also look at things like algae blooms and risks, and sometimes unseen risks to folks who unknowingly come into an area that represents a fairly high degree of risk in terms of contact with water or exposure to harmful algal blooms. And so there are pieces to the environment that really impact not only the outdoor recreation experience, but the benefits from those forests as well. Part of our assessments included looking at niche opportunities, locations that are unique, that cannot be located elsewhere or easily substituted, and the focus in on how to best preserve those unique experiences, and perhaps in some ways focus resources and management energies towards those, pairing ecological treatments with planning for outdoor recreation that's a high quality experience, so that those benefits that are derived are maintained.
Could you talk a little bit more about niche experiences? I've never heard that term before, but it makes me think like, oh, like waterfalls, or like what's a niche experience?
So like the giant sequoias, or well, that's one. Another is the coastal area up on Big Sur, just north of Pfeiffer, Big Sur, south of Monterey, and looking at the unique setting there in terms of the visual effects, the ability to connect with water, the uniqueness in that area. Some of the wilderness locations, such as aspects of the San Gorgonio wilderness, and so on. So we have a number of these. It was a way we described the unique experiences that could be pinpointed from specific locations, characterized not only by the ecological features, but also how outdoor recreationists experience those locations and how those are unique in comparison to other types of outdoor recreation opportunities.
Pat, would it be fair for me to see a common thread through your description of niche experiences as some of the natural environments that are awe-inspiring?
Yes, I think that would be correct. Yeah.
Great, great. And in your presentation, Pat, you talked a bit about some of the obstacles, including very practical obstacles, distance, money, access to transportation. And that strikes me when we think about some of these niche experiences and the awe of nature. Do you have any thoughts about practical ways that people who are lacking access to money and transportation and some of these other things can still get these experiences, whether it's in terms of individual behavior recommendations, or maybe it's at the level of policy recommendations?
I think that's a great question. And it's met by some of the transportation pilots that have been implemented across the United States. For example, on the Angeles National Forest, a pilot program was developed to take vans into communities where it was unusual for members of that community to be able to get to forests for a visit, and they were provided with free rides up to the forest and dropped off for a period of time, collected at the end of the day, and brought back home. There is a program looking at connecting folks from the Union Station in downtown LA all the way up to some sites on the Angeles National Forest through transportation networks. These are not the only examples. There are examples across the US from national parks and national forests that have implemented various systems to be able to get folks from their communities where they live up to the forest. There's also a strong focus in on youth experiences by bringing kids, school groups. We had a partnership with a local city museum and a city park nearby for an urban wilderness park to bring kids out for the day and have them hike and go through some creative arts experiences. So providing opportunities that may not otherwise exist and trying to develop that familiarity with the out of doors early on.
Great, thank you. Neil, I'm curious in your research whether you have seen some of the same kinds of patterns that we heard Pat describe in her presentation, where there's a lack of access to basic transportation resources and other resources among some communities that then may be one of the factors that distinguish the experience that some communities are having from other communities.
Yeah, a lot of what Pat was saying there resonated with a lot of our findings. That the one general thing we know from lots of work in psychology is the easier it is you make something for people to do, the more likely it is that they're going to do it. So one thing participants in our studies have talked about is not having that direct access to green spaces, and like makes it harder to spend time in nature, right? If it's really far away, if you're not having free or cheap public transportation options to get there, that's another barrier and so forth. But the other thing that Pat mentioned that I do want to spend some time thinking about is the role of time as well. Like, it's not just the money, it's also the time to get there. And as I was thinking about the question you asked her about interventions, and like one of the other areas I've been paying attention to over the past couple of years is we've debated this. What do we do about work, and how much time are people spending in an office versus working from home? And like one thing that has come up from that literature is the more flexible work options, when people have a couple of days when they're not spending 2 hours in the car commuting, they can reallocate some of the time to spending it outdoors in nature and so forth. So I think these are some of the other ways that we can think about the ways that we structure so many aspects of our lives, right? There's the structuring of cities and other spaces, and there's lots of work on that. But even thinking about how we structure work environments and workplace schedules, and like these things also matter for people's ability to go out and experience nature versus being stuck in a car for an hour each way and so forth. So those are some of the other things I want us to think about.
Great, thanks for that. And Neil, I wonder if you would be willing to give us some information that I think is going to provide a little bit of context for some of the questions that will follow on. And here's the question, but it requires a little bit of setup. Our audience here today is a diverse audience. We have people, no doubt, in our audience who are PhDs in psychology in various different subdisciplines. We also have folks who are environmental scientists and biologists and other kinds of scientists who maybe have had limited exposure to psychology. We also have students as part of the audience who are just beginning to learn about these issues. And some of the questions that have come up in the chat have related to the differences in types of psychology. So you've described that you're a social psychologist. I'm a personality and social psychologist. I lead the Office of Applied Psychology at the APA. There are probably many clinical psychologists who do therapy with patients who are here in our audience. Can you give us a general thumbnail landscape of how can all of these people be psychologists, and what are the different ways that psychology manifests itself? And that may help us then go to some of the more deep dive questions about psychology's contribution.
Yeah, that's a big question, and I'll try. But one way that I think about this is through. I'll start with jargon and then I'll explain it. But something we talk a lot about as the ecological model, and I know multiple fields use that kind of language too. But in psychology, we're talking about when we use that term, we're talking about really different levels of analysis for thinking about the human experience, right? So, the clinical folks, for instance, may spend a lot of time in one-on-one interactions trying to think about that person's unique experience and talking through those experiences and so forth. Whereas on the social psych, and we are spending lots of time thinking about broad group dynamics and how do things like broader cultural forces affect people and so forth. And the personality folks are trying to figure out how stable are we over time and so forth. And I think those different levels of analysis and ways of thinking about the human experience are then useful for figuring out, well, how does that connect with, you know, um, what are people going to be experiencing as they interact with different parts of nature, right? It can help us try to model what is, um, uh, a person living in one kind of place versus another kind of place is going to think about how might the same person change in their experiences with nature as they move throughout the lifespan. How might you, come up with a set of recommendations for one person versus a community versus a country? So these are some different ways that I think psychology can interact with these broader questions.
Great,
Hopefully
thanks.
that helps.
No, absolutely. That was a great summary, and I think lays the groundwork for a question that I wanted to pose to Craig from your unique perspective of coming here from WWF, and you pointed out as part of your presentation, and Amy Smith pointed out as well, the desire to collaborate with diverse disciplines, including psychology. I'd really be interested in hearing more about where you see the connections between conservation and psychology, and whether there are particular ways that you think that more collaboration between psychological scientists and environmental scientists would be useful.
Yeah, I'm really glad that you set me up with Neil's description of psychology before I had this question, so I have a better way of understanding how to answer this question. Because I think it does get to, like at WWF, what we spend a lot of time doing is looking at, we're a science-based organization, and so we spend a lot of time looking at what does the science tell us is going to do better things for the Earth and for people. But translating and applying that science in the world is very different than doing that science and understanding kind of those realities behind people and nature. So translating it into what do we do and who do we work with is a huge part of what WWF does. And we do it all over the world. Maybe you mentioned we work in 100 different countries. And the way that individuals respond to how we apply that science, the way that groups respond to how we apply that science, and the way that governments and respond to how we apply that science is very different, both within all three of those groups and across all of the different places that we work. So once you start to multiply all those things together, you get thousands of combinations of ways that you could approach a problem that are just too much for one organization to deal with. And so if we can think about the ways that people, like in Patricia's work on the ways that people interact with and want to engage with national forests and nature. How do we tap into that so that we can understand how to achieve the types of things that science is telling us we need to achieve? So we don't want to be going down a road where the advocacy work that we do or the types of things that we're advocating for don't ring true for the types of people that we're looking to influence to change the world and people's lives for the better. So I would say that's probably the crux of what our interest in this collaboration is. The problem is that we don't have any of that experience and we wouldn't pretend to, right? So I think that it's important to look outside of conservation and to look to other disciplines like psychology and others to really understand how can we do our jobs better and how can what we do as an organization ring really true for people. And I think that's probably the crux of it. Yeah.
Great, thank you. And Neil, you pointed out in your presentation that part of what you study is how people think about environmental issues, equity issues, justice issues, and you mentioned that part of the answer to that is, well, who is it and in what circumstance? So it's the person and the situation. And that goes to what Craig was just saying too, that to be effective, you can't appeal to just one small group of people. But these issues can be difficult sometimes. And so I'm curious whether you have any thoughts about how to approach conversations about tough topics like climate change, which is connected to forests and connected to sustainability, but it's also a politically charged term, and it's something where there are people who have strongly entrenched pre-existing beliefs that can come up even in family context. So how do we begin to break through some of those communication barriers?
Yeah, thanks for this question. I think it is important to figure out like where people are starting from and fundamentally what do they care about, and that can be a basis of the conversation. So, the example of climate change, for instance, yeah, that term has become very charged, and leading with it in conversation probably won't get you very far unless you're in a circle that's, you're basically in an echo chamber in some ways. But there are many manifestations of it that people are willing to talk about, right? I'll give a couple examples. Earlier this year, I was in New Orleans and was having a conversation with someone there who has been a fisherman for generations, right? We're talking, and he very quickly is like, I'm not a political person. Like, I don't want to talk about politics and climate change and so forth. But he also mentioned seeing how much things had changed and how he has had to change his fishing because of it, right? That there are all of these areas that the way that water flow works is just different, and then therefore the kind of fishing you can do has had to change. He talked about how for his house, he recently had to like raise it up on a few more stilts. So if you've never been to New Orleans, it's very common there that many houses have to sit on like layers of cinder block as the sea level rise. So we could talk about the fact that well you've had to move your house up a few more layers. So that's talking about climate change without talking about using that label per se, and you can have a deeper conversation about those issues. Here where I live in central New York, we don't really get that many big winter storms anymore, or and the winters are just much warmer now than they used to be even 10 15 years ago, the first time I came here. And these are things that people notice, right? And so you can have conversations about what those changes mean for people's everyday lives. And it's much more concrete and easier to engage with than abstract academic jargon about climate change. That's not to diminish the importance of the work behind that, but that's just not what most people want to talk about or engage with. They want to think about the real world implications of that construct for their lives. And so I think many people are more people are willing to have those conversations than the labels that we might come up with in our academic circles.
Great, thank you. And Craig, so much of the work that WWF does is communication work. I'm curious if you have anything more to add to Neil's comments.
Yeah, I mean, I would just entirely agree with that. I mean, we do work on the ground with communities all over the world, and so this is not just a communications issue in the US. It's how we communicate about the issues that are really affecting people's lives. And in all of that work in dozens of places around the world, not once has a person ever mentioned climate change as the reason why they want to restore land or do something that would be in line with living in harmony with nature. Climate change does not exist at that level. It's like the kitchen table things. It's the, yields are not improving. The fishing example that Neil mentioned, things are changing, and nobody on the ground really cares about climate change. Climate change is affecting them, absolutely, and there are definitely WWF certainly cares about that, and we're doing a lot towards addressing it. But on the ground, like having conversations about climate change and about environment. Neil also wrote a great paper that I read prior to this about like the things that we're talking about that are environmental issues that people are interested in. Those are environmental issues. We're just not calling them environmental issues. So however you want to talk about it, whether you're doing forest restoration on one day or ecosystem-based adaptation on the other day, we're all doing the same activities. They're all the same thing. So it doesn't really matter how you talk about them, but you like communicating about them. And the point that I made about how do we communicate among different groups so that those messages ring true. It doesn't matter what the words we use really are, as long as what we're looking to do ends up benefiting the things that we want it to benefit and not causing any harm.
Thanks, Craig. And Pat, from your years working in a government context and approaching this from communicating with policymakers and constituencies and everything that's involved in that context, I'm curious whether you have anything to add.
I appreciated the preceding comments. I would be careful in overgeneralizing to say no one uses the terms climate change, because in fact, there are community members that do, and they're very concerned about that. If we look at the larger trends in terms of concern across America and how climate change rates out, there's a lot of variability there. We need to be mindful of that. But I really do appreciate the comments around finding the core values that matter. And this, echoes back to what I was talking about related to outdoor recreation and the environment. If you're going to have these conversations, we have to tailor what resonates and figure out what really matters to people to have a meaningful conversation. And if we're not willing to do that, we're losing out. And I also appreciate this idea around shared values, which is something I've studied, which is, what do we focus in on that's important? So what's impacting your life? When we're talking about shifts in these vulnerability assessments and we run the workshops, we go in and have conversations with a number of different recreation providers and other partners and folks doing the ecological and biological work on the forests. And we talk about shifts, actual tangible changes that are already in evidence or are projected to occur, and how those can be addressed. So more anchored conversations rather than focusing in on the loftier stuff, though certainly that's a background. We have the climate projections and whatnot as a piece of these vulnerability assessments. But really talking about, what are you seeing right now? What have you been experiencing? And how are you dealing with that? And what do you think is going to get worse? And how can we manage that together? And incorporating that into these assessments is of significant value to the folks on the ground who are trying to sort out what to do next and how to deploy resources to be most effective. So I appreciate both of the remarks from Craig and Neil in that regard.
It strikes me that one of the many important groups to be having these conversations with is Indigenous peoples. And so I'm curious, just to open it up to all three of you, is there anyone out there who's really doing that work and learning about the values that Indigenous peoples are bringing to this conversation, what their interactions are with forests, what can be learned from that, and how to best work with and learn from Indigenous peoples as part of this?
Yeah, I'm certainly happy to take that, and I know that the U.S. Forest Service also does a lot of work with tribes and nations. You know, WWF really recognizes that indigenous peoples are the Earth's most important stewards of natural resources. So across the tropics, and I mentioned climate change, and the way people talk about it. Most of the work that we do at WWF is in the tropics and in other countries, and we don't do a whole lot of work in the United States because it's really well covered by a lot of other organizations that operate in the U.S. But across the tropics, you know, indigenous territories have a fifth less deforestation than non-indigenous ones. According to our Forest Pathways report from 2023. And we really respect Indigenous and traditional people's human and development rights, and we really recognize the importance of conserving cultures and work with Indigenous peoples and local communities in almost all of the places where we have offices. So we collaborate with them, their organizations, and work to conserve and sustainably use natural resources and provide rights-based approaches to advocate on issues of common concern to Indigenous peoples and to the work that WWF wants to do to enhance and maintain human well-being in nature. So in our forest work, I can provide some examples, but maybe I'll flip it to the other panelists to see what their experiences are as well.
So I'll just go next. Thanks for that note of what the Forest Service is doing. There is a lot of partnership with federally recognized tribes, evolving into essentially co-management of some areas to restore native systems, native ecosystems, and to focus in on the importance of productivity around, for example, black oaks and harvests or native grasses. Something that was rather enlightening for me a few years back before I retired was a discussion around connectedness with nature and how that resonates or doesn't resonate with indigenous populations. And the comment that, you know, in some ways, that whole framing just shows a lack of understanding of relationship with nature, which is the focus isn't on building a relationship that is absent. The focus is on celebrating and practicing and living a life way that embraces that connection, that bi-directional relationship, that embeddedness in nature. So I think as a psychologist, it helps me remember to be mindful of how I'm framing things and how culturally bound some of that framing may be. And, you know, to really think about, you know, like I mentioned in my slides, shifting the narrative around what's the relationship with the land and what do these different types of activities and places really mean, so that we can incorporate those broader meanings and really understand them better, to have a more meaningful dialogue about resilience and well-being.
I just want to quickly jump in and echo what Pat just said, because that has been a strong theme that's come up in our work as well. The Indigenous participants that we've had echo the same thing of, this is what we've been doing. You all didn't count it before. And so really thinking about that, that framing from our perspective of the researchers studying this. So how are we even conceptualizing these things? Are we counting indigenous practices or not? Like that's something I think we need to do a lot more work on. And I'll say, even in some of the work in at least psychology, spending more time reconceptualizing some things and just recruiting more indigenous participants to participate in our studies, I think would go a long way in improving our own understanding of these issues. So those are some of the initial comments piggybacking on what Pat said.
Great, thank you, Neil. And as I mentioned, we have a diverse audience for this webinar. We surely have some folks who are wanting to learn more. Some may be students, some may be advanced in their careers, but this is a topic that is new to them. And so, Neil, I kind of want to go to you first as our academic in the group for some thoughts about where do you go to learn more? What should people read? What books should they buy? What magazines should they get to learn more about the kinds of issues that we were talking about here today?
Yeah, so I don't know how to distribute the link via the chat, but we'll make sure you get it later. But one of the pieces I think will be really helpful to read as a starting point is there's this piece in it's the annual review of, I forget which, of environment and resources. That's a piece on environmental justice, right? That has a great history of how these fields emerged, the tensions that emerged over time, and how that led to sort of different subfields emerging and so forth. I think that's a great historical piece for getting an understanding of how we got to where we are now and how people are thinking about these things. In my remarks earlier, I talked about the what counts as an environmental issue findings. That's another piece for seeing some of the survey data on how and why different groups think about these issues in different ways. And then building on the last set of comments around indigenous perspectives, I've really enjoyed the book Braiding Sweetgrass. That's another one. I'll find the link and share later, which is a book by an indigenous ecologist who has spent a lot of time thinking about not only how do we do the science, but then how do we honor indigenous knowledge systems from generations, and as we think about this. So those are some recommendations to get started.
Great, thank you so much. And we are approaching the end of our time here. And so I wanted to mention that we will, when we send out a link later to all of the recordings and so forth, we will also include some materials. And so some of the things that you have heard referenced here may be included or linked to or repeated so that it's easier for you to remember those items. And Craig, I see that you have your hand up.
Yeah, I just wanted to respond to the existence of indigenous knowledge systems because I worked for a long time in forest landscape restoration, where basically we would go into places that were very degraded, and countries and put together plans for where were the best opportunities to restore. And one of the things over years of doing that we came to understand was that when people looked at the natural resources and Malawi was a great example of this. We asked at the district level women that collected fuel wood to make charcoal what their favorite species were. And we had no idea we would get the results that we did, but the older women that were part of that assessment had a very strong affinity for a species of wood that really didn't exist anymore. And the younger women didn't have any idea that it had even existed. And we saw this play out in not just Malawi, but in lots of different places where the knowledge around how communities utilize this natural resources was disappearing with people's old age. And in the last 50 or 75 years, we've basically reduced the amount of nature on the world by half. So half of the nature that was in the world is now gone. And for in our Living Planet report, it's even more. So natural populations of species. Not only were we losing that, but as generations lose that knowledge, and we really are in a really small window where grandparents still have that knowledge, and it's very, very close to not being available anymore because the human lifespan has equaled about as long as we've been destroying nature for the last 50 or 75 years. So the ecological memory that we have in people still is there, but it won't be there for long. And I think that it's so critical that we recognize that now and take steps to make sure that it doesn't disappear forever where we can.
Well said. Thank you so much, Craig. Pat, can I go to you for some closing comments?
Yeah, I just want to make a quick plug for Division 34 of the American Psychological Association. People are asking about references, for example, on research around how to communicate about climate change, or how people think about the environment and relationships to the environment, how to encourage environmentally responsible action. The folks within that divisions have an extensive amount of research experience in that topic. So I hope you'll take a look. Thank you.
Great, thanks, Pat. Yes, that's a really important point, and we are, as I mentioned at the beginning, delighted to be able to be collaborating with Division 34 and WWF on this three-part webinar series. And so this brings us to the end of our time here together. I want to thank everyone in the audience for your time and attention and for all of the thoughtful questions and comments that were submitted. You will be receiving a very short survey, and we hope that you would be willing to complete that because it will help us to improve our programs going forward. And this webinar, as I've mentioned before, was the second in a three-part series of this collaboration. And so be on the lookout for the third in the series, which will be coming forward soon. And I know that we are really looking forward to that because these sessions have just been fantastic discussions. And so I want to thank Neil and Pat and Craig for all of your preparation for today and for your thoughtful comments and discussions throughout. Thank you so much.